Hello everyone, my name is Minh and welcome to my presentation for Decision Support System class Fall 2017. And today I will talk to you about electronic health records and data analytics in healthcare. Let's go over our agenda. First, I will talk about the reasons why I chose this topic. Then I will explain the data architecture in healthcare, including electronic health records, which I will refer to as EHR for the rest of my presentation. In the final two sections, I will also talk about the benefits and challenges. So before I start, I would like to note that in this presentation, I try to present the information in a easiest way for you to understand. But I have more information in my paper, so if you would like to read my paper, I'm willing, I'm happy to send you my paper for more details, and you can always look it up for information later if you somehow grow more interested after my presentation, which is my hope. And on that note, please take it easy on me if I miss something, because this is a very complex issue, and I really look forward to our discussion on Canvas. Let's get started. So every year, the US spends around $3 trillion on healthcare, which is the most by any country in the world. However, it is ranked at 37th position on healthcare efficiency ranking by WHO, which is a problem because once you spend that much money, you're expected to be ranked a little bit higher, especially if you look at developed countries alone. America is on the bottom half in terms of healthcare delivery and efficiency. Also, healthcare is an industry that generates a lot of data. By 2025, it is expected that the industry will generate 10 to the power 24 gigabytes in data. And this tremendous amount of data will cause organizations in the industry trouble in managing and analyzing data. And this is where data analytics comes in, because multiple studies show that it can be used to improve care, lower costs, and help organizations manage and analyze data efficiently and properly. Also, this is an area that I'm always interested in, and I think like healthcare is something that we can all relate to and consider important in our lives. So data architecture in healthcare, it is very similar to any other industry's architecture. Like data goes through the ETL process: extract, transform, and load. So if you see on the left hand side of the graph, data can be extracted from multiple sources like pharmacy, labs, radiology, medical notes, and admission forms. There will be many more sources where you can get data, and after extraction, data will go through the transformation and loading process, where it will be cleansed and ready for analytics for different purposes, such as point of care, statistics, and medical research. So first of all, point of care, what do we mean by that? Means that data analytics can provide clinicians and doctors with a comprehensive view on a patient's medical history. And the more information doctors have, the more informed decisions they will make, and the better care the patients will receive, which is a good thing for everyone in the industry. In terms of statistical study, organizations can use data analytics to perform, for example, demographic study on patients, or on a certain disease or conditions. For example, it is reported that healthcare organizations can now use data analytics to identify the top 1% of population that drives the healthcare cost. That way they can focus their resources, they can better allocate their resources to accompany this type of patients, to lower the cost and to provide them with better care. In terms of medical research, as you can see on the right hand side, organization can use machine learning and decision tree to predict the outcomes of laboratory tests or treatments. For example, like C3 representing diagnosis of a certain condition, L2 representing laboratory tests, and D1 representing age. So the results of the diagnosis and the test and the age of the patient will all affect the outcomes of the test and the treatments. So with the machine learning, we can predict the outcomes without actually putting the patients in danger of the real test, without even knowing what the test would do to the patient. So it will improve first of all, the production of the medicine, also reduce the risk of the patients in terms of taking a certain type of treatment and test. So in summary, data analytics can be used for point of care, statistical studies, and medicine research. Data architecture in healthcare is very similar to other industries' architecture. So that's what I would like you to take away from this slide. Another point is, if you look at the middle image of the graph, you see three people icons in three different colors: blue, pink, and green, and they represent personal medical records of patients. Now they all have the same standardized variables. If you look at like the symbols on the left hand side of the blue column, you see the different variables, data variables. Even though the medical records may vary, as you can already see on the graph, because people have different conditions, that's obvious, and health status. How medical records should have standardized variables, and that is the concept of the EHR, which about in a few seconds right now. So you can see on the right hand side the formal definition of EHR by the Center of Medicare Medicaid Services. In summary, in a simple term, it is the one version of truth that carries all the medical information of patients, and it is a cornerstone of big data in healthcare. Like what you saw on the previous slide, data analytics is performed on the on EHR, standardized EHR. So without EHRs, data analytics in healthcare wouldn't work. And with the EHR, the communication, the availability, and the transfer of data in healthcare will be improved significantly, because information can now be transferred and communicated in a matter of seconds, in a matter of a few clicks. There will be no more storage of tons of paperwork. There will be no more requiring patients to fill out forms after forms in different care providers. Yeah, and there'll be so much time saved from administrative work, and doctors can have full review of a patient medical history in a matter of seconds, and they can look at an iPad or in their hands when they meet with the patients, or when they are about to decide what treatments the patients will receive. So electronic health records is a very important concept in terms of data analytics in healthcare. So there are multiple documented success stories of data analytics in healthcare. For example, Premier, one of the leading organizations in the US, claimed that they saved 29,000 lives and $7 billion thanks to data analytics. Columbia University Medical Center claimed that they reduced the time needed for bleeding stroke diagnosis by 48 hours. Now, this is a big jump because the matter of life and death can be decided in seconds or minutes. So 40 hours is a huge improvement. As you can see below, like other organizations reported improvement operationally thanks to data analytics, and I'm sure there'll be more. So I'll be happy to share with you what I found in my paper, and you can always look it up on Google to find the up-to-date examples of organizations using data analytics in healthcare industry. Unfortunately, on the other hand, we still have challenges to overcome. Some academic studies reported conflicting results or statistically insignificant proof that data analytics and EHRs contributed to care improvement and lower costs. There are two reasons why that happened. First of all, and the biggest challenge that we have is the lack of nationwide standard in EHRs. There's no compatibility in EHRs among healthcare organizations in the US. Like clinical, medical, and financial records are stored and created differently. And also, like each care provider has their own data formats. So to create nationwide compatibility right now is still a massive challenge because with that compatibility, like the benefits of EHRs would be reduced significantly. The other reason is the high cost of EHR implementation. So one study claimed that it cost them $32,000 per clinician to implement just the basic features of EHR because they have to invest in like hardware, they invest in like infrastructure, in the training. It's not cheap, even though that is only for the basic features. Now imagine what the cost would be if they implement the full package with full features of EHR. The cost would be astronomical. I could only find one study that reported high cost in implementation. I would love to know more if you have found any like examples for this point. Another concern in terms of big data analytics in healthcare is the data privacy. Now, every year since 2015 has been a banner year for ransomware and hackers in healthcare industry. Every year witnessed like a record number of incidents and record losses and damages in terms of ransomware. For example, like in 2017, we witnessed the record car damage of $380 per compromised medical record. So, and actually, James Comey, the former director of FBI, said that healthcare industry was a piggy bank for attackers, for ransomware people. So moving forward, I don't think this issue will go away anytime soon. I'm working in a managed service provider company, and healthcare industry is a profitable market because they need to install a lot of security features for their data infrastructure. So every MSP is targeting healthcare industry, healthcare organization to sell their security services because they know that it would be a big issue and it won't go away anytime soon. Another concern is the reluctance from doctors. Doctors want to have freedom over their choice of treatments for patients. They don't want to expose their experience, their unique way of treating patients. They don't want to be watched over because now like everybody has access to how they treat patients. Also, they claim that they don't want to deal with patients as customers because when that happens, patients will be more difficult to work with. They would think that they have more power as customers, not as patients anymore. So reportedly there is some pushback from doctors, but I think it with some proper training, that issue can be solved in the future. Another big concern is inadequate machine learning. Now, 80% of medical healthcare data is unstructured in the form of images and medical notes. So right now we don't have the technology to kind of analyze images and text to extract actionable insights and information. And actually, like such data carries a lot of good and important information in healthcare. So we're missing out a lot of data, and it will be kind of formidable. I wouldn't say impossible to overcome, but it would be a formidable challenge for healthcare industry to tackle in the future. So in summary, you see that like there's great potential in using data analytics and EHRs in healthcare. Unfortunately, we still have massive challenges to overcome. And in all the papers that I have read, they all call for like more studies, especially in large scale, in terms of like EHR data analytics for like unstructured data such as text and images, because every study so far was conducted on a small scale, one entity basis, and to kind of understand more, to have more like evidence, we need to have like more large scale studies like in the future. And I think the US can also learn from countries that have success in EHR implementation, such as Nordic countries. Now I know that like those countries have much smaller population than the US, and therefore the challenges will be likely less severe. However, I believe that there's always something that we can learn from those countries in terms of how to implement EHRs efficiently and properly. The final point is that the government plays an important role in all of this, in providing leadership, incentives, guidelines, regulations for like EHR and data privacy across the country. So if you want to have working EHR and data analytics in healthcare, the government will play a pivotal role moving forward. Now, I hope you enjoy my presentation, and I would love to have your opinion and questions. Thank you.